Good afternoon, Rotarians. Welcome to our Monday meeting. I don't know how many Zoom meetings we've done so far, but we're going to continue this as long as we need to do until we can get back together in our, I don't know that we'll ever get back in our normal way, but these Zoom meetings are doing very well. As we'll get started, as per our normal method, Mike George, I'll ask you to do the reflection, followed by Dave Weinbrich with the pledge. And then we're going to have George Eistetter do the four-way test. So.
Dear God, in times of great uncertainty, we often look for the answers to the questions why. Why this? Why now? Why us? We struggle to remember that you have a plan, and that plan is unknown to us. Let us pray for faith in you and your ways, faith in others and their work to eradicate this pandemic, faith in the nonprofits in our community serving those in need, faith in our fellow men and women. As Rotarians, we have always taken the lead role in protecting our community's greatest asset, its people, regardless of their abilities. Let us heed the call of service above self. Let us put words into actions, actions into love, and love into victory. Amen.
Thank you. David?
Thanks, President Tim. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Thank you, David. George Eistetter, would you lead us in the four-way test?
Will it build goodwill and better friendships? And fourth, will it be beneficial to all concerned? Thank you.
Thank you, George. Thank you, David, and thank you, Mike. We have a sponsor for the meeting this year, or this month, and that's Donna Bogan. I think you're there, are you, Donna? Anyway, Donna has helped us get Bogan and Hartman financial planning to sponsor the meetings for this month. Thank you very much, Donna. As most of you know by now, we've restructured our how the meeting goes. We've moved the speaker up to give the speaker more time on Zoom and more time for questions. So without taking too much of your time, I'd like to welcome Bob Savage, who will introduce our speaker.
Thanks, President Tim. Good afternoon, everybody. I'd like to welcome Bob Baxter to Rotary today. And Bob Baxter, for himself and the organization he runs, would certainly be a welcome and apt guest any week. But especially, I think, during these times, it'll be pretty interesting to see what Bob has to say, and from Mercy Health's perspective. Mercy Health is actually Ohio's largest provider across the state. And Mercy Health North, that is now referred to as part of the Bon Secours Mercy family, I believe, and Bob can tell us this, is Ohio's largest region for Mercy. And you've seen some of the stats, I think, in the bio, but over a $1 billion organization in Northwest Ohio. Bob has actually been, although it hasn't been in Toledo for several years now, but he has been part of leadership in Northwest Ohio for quite some time, where Bob ran St. Rita's Hospital and Partners down in Lima, Ohio, which is the next biggest hospital outside Metro Toledo. Bob's originally a native of South Dakota. Bob has worked for Catholic Heart Partners for Health Partners rather, for 18 years. And as said, as you might guess, and his responsibility sits on a number of local boards, from the Regional Growth Partnership to the United Way to Connect Toledo, and has sat on statewide boards, including currently sits on the Ohio Chamber of Commerce and even national boards in the health field. Bob had told me when I met with him before that he's a runner. What he was gracious enough not to tell me was he's a much better runner than I am. He's qualified for the Boston Marathon. And Bob and his wife, Rita, have 4 daughters, 3 of whom are in college. And without further ado, Bob Baxter, welcome to Rotary.
Thanks for that introduction and for the privilege to have a chance to address Rotary this afternoon. Actually, this is a great time to do it. This is the intersection. This is Monday where we're celebrating both Nurses Week and we're celebrating Hospital Week all at the same time. And I think that, as we're working through this pandemic and this crisis, we have caregivers, physicians, nurses, associates, and those who support them who give and give and give, but they never give up. So I'm incredibly privileged to be in this role, especially at this time. And I'm just thinking back to the reflection a little bit. And while it may not be for us to know why, I thought what I might try to do today is speak a little bit to what Mercy Health is doing during this national pandemic, how we're addressing it, and how we're planning for the future as well. So I hope that kind of fits what you were interested in. Just the other thing I'll share with you is not only is it Hospital Week and Nurses Week, but of course we just came off Mother's Day. And as Bob said, I have 4 daughters, one of whom is still at home. So I thought I should at least give you the update as what's going on at the Baxter household with homeschooling. It's gone well so far. We've had 1 teacher suspended for drinking. We've had 1 teacher one student suspended for fighting. Although that's probably secondary to the fact that we've had 1 anonymous bomb threat called in to get classes canceled. So hopefully your Mother's Days all went well. What I would want to share with you as we look at what Mercy Health is doing is, if you go back to when the Gray Nuns came to Toledo originally, we were fighting, they were fighting situations that in some ways were similar to this. At that time, the challenges had to do with cholera and it had to do with malaria. So I think our roots with disease and infectious disease go way back. And I think it helps inform us as we were putting together our priorities for how we would address this situation. And really at the outset, for all the decisions that we knew were coming down the road, we really wanted to have a framework by which we would make our decisions. And so that framework really had to do with number 1, containing the virus. Secondly, minimize the exposure of people to the virus. Be the best possible stewards of our resources. And certainly you've heard a lot about the need for personal protective equipment and the challenges with that as an example. And then protect our staff and healthcare providers so we can continue to provide the excellent healthcare that the sisters made an expectation those many years ago. And the framework by which I wanted to talk about this as far as this moment of the what and hows is to identify kind of the 3 challenges that we knew we had going into this, and at a high level, how we work through them. So those 3 challenges, first and foremost, had to do with staffing. How do we take care of our staff? How do we protect them? How do we make sure that in a volatile, uncertain, complex, ambiguous environment that we were appropriately providing care and making sure that not only were they safe, but they weren't burned out? And what did that mean to the model by which we were providing care, not only to those people who were coming in with COVID, but those folks who didn't have COVID, who needed more traditional services. And then the other 2 buckets had to do with our facilities and then equipment and supply. So I'll touch on those briefly, but I wanted to share a posting from one of our nurses who works in the COVID unit. And so just to give you a visual, we try to cohort most of our COVID patients in the Regional Heart and Vascular Center. So as you drive down Cherry Street, if you think about traditional St. Vincent's campus, on the other side of the pedway, on the east side of the pedway. You've seen the building there. That's our regional heart and vascular center. So that's where we try to put our COVID patients. We do also have them in the rural market. We'll have them at St. Anne's and St. Charles, but the sickest of the sick, we really try to put there. And so this post from one of our agency nurses said, I know there's a lot of negativity out there right now, but I want to give a shout out. There's 3 floors of nothing but positive, I'm a traveling nurse from Ohio, and I've been contracted at Mercy St. Vincent's in Toledo in their COVID ICU. There's 3 floors of nothing but positive COVID patients, 2 floors of vent patients, and 1 is more step down. We walk in through our garage, get our temps taken, and then we go to the basement and change into hospital provided scrubs to go to our huddle location, and we get our N95s, booties, scrubs, caps, nets, and face shields if we need a new one. When I tell you this hospital is amazing during this, I'm not lying. We have proper PPE every shift. It's such a blessing. They provide us with catered delivered lunches every shift. They appreciate everything we are doing and let us know every single morning and evening. Such a great group of nurses that work there. So thank you to St. V's for caring about us so that we can give care to our patients without fearing, for the most part, that we are going to get through this. So I thought that was just an unsolicited reflection that really touched on a lot of the things that we want to be able to do. Provide a safe environment where people feel good about coming to work. And I will tell you, the thing that we are probably most proud of at this moment in time is that none of our staff on the COVID unit have tested as being positive for COVID. And when you look towards Detroit and you see what's happened with Beaumont and some of the other healthcare facilities up there, you know that that's not something to be taken for granted. Nationally, the numbers are about 9 to 10% of healthcare workers are getting infections. So I think there's a couple of things that help us with that. One has been the work to preserve our personal protective equipment to make sure everybody has everything they need to provide safe care. Some of it has to do with our facilities, which I'll talk about in a second, as well as the care model that we've put into place. So early on, we've had tremendous physician leadership, and I really want to call out Dr. Haregi, infectious disease expert, Dr. Jim Tita, pulmonary critical care medicine. And what we put into place was what I would call kind of a pyramid model for mass ventilator protocols, where we have one experienced intensivist who's managing multiple teams to be able to take care of as many patients safely with as few resources as possible. And that allows us to preserve staff so they don't have to work as often in as many shifts. And what we found is that that's a model, as I think you can tell in the quote, that's been much appreciated by staff. And in fact, what we found is that there was more anxiety across the pedway on the non-COVID side of Mercy St. Vincent's, because people didn't have as much understanding as far as what was going on the COVID side, and had a little bit of fear around that, even though the COVID patients were being put elsewhere. So we improved our communications with regard to that, to lessen that anxiety. And in fact, I was rounding last week on one of the med surge floors and had the chance to visit with one of our newer nurses who was incredibly disappointed because she was supposed to work the COVID unit. It would have been her first time doing it. And she was very excited about that prospect because she'd heard good things about the camaraderie, the rapport, the teamwork, the model over there. And because the census was lower on the COVID side, which is the good news, she was called off, so she didn't have to work the COVID unit. So I think from the standpoint of appreciating our staff, taking care of staff, providing them what we need, we have done what the sisters would have expected of us. I would also then talk a little bit about the space. And going into this, we were faced with all the unknowns that everybody else had. How big was the surge going to be? What sort of disease issues were we going to face? And critically, how many ICU beds were we going to need? How many ventilators were we going to need? And that really was a critical issue everyone was facing. Sometimes when good preparation meets good luck, you have a great situation. And that's what we had. Our team has done an amazing job preparing for this. We had our incident command center stood up early on. They've been through difficult times before. But what we found when we looked at how we were going to do this is that our regional heart and vascular center has the capability of being turned all negative air pressure, which is incredibly important from an infection control standpoint. So we did that, and we had the ability there to run 77 ICU type beds. And in fact, as we were getting into this, we looked at the fact that we could essentially put 2 patients in a room should we need to get over, most rooms, to get over 150 ICU patients in the Regional Heart and Vascular Center. So I think, when you look at some of the reasons we've had such safe care being provided over there, it's all the things I talked about, the model, the equipment, but as well as the infrastructure being in place. So that was a bit of good luck that's worked well for us over time. I know when they built that, they weren't necessarily thinking of that, but that's been fortunate for us. We do a lot of internal projecting as far as when we would expect to see our surge of COVID patients. And so just to kind of give you a perspective, we probably saw our spike, and we've had as many as 107 COVID positive and possible COVIDs in-house in one day. But our peak probably ran from April 5th through April 19th. And then it's come down a little bit since then and plateaued. But during that time frame, we used about 85 ICU beds on our worst day. And I just mentioned we have capability in that one building for over 150. And then we have ICU bed capability in our other non-St. B's facilities, such as Charles and Ann's, Tiff and Willard. And when you look at our vent situation, and you certainly heard about some of the need for additional vents to be produced, the paucity of vents across the country, especially in places like New York City. On our worst day, we've only used about 30% of our vent capability. So we're projecting out in the future. We think probably, these numbers change. I think someone said once, it's hard to predict, especially about the future. But right now, we're projecting May 25th or so, pending what happens with the social distancing relaxation, as being our likely worst day. And even with that, we feel like we're going to have ample resources to take care of that surge. And then I'll just talk about supplies for a moment. It's a boring topic, but it's an incredibly important one for us, and it's actually a day-by-day topic. And really, this is where I want to just appreciate the depth of the health system that we have. So while providers all over the country have been struggling to get PPE, we certainly have as well. And the challenge changes day by day. Sometimes it's N95 masks, and we'll always take more of those. But some days it goes to gowns, and then some days it's disposable stethoscopes, and then in other days it's bouffant caps and booties. So it just changes from time to time, but we've never had to go without. And I think that's a tribute to our supply chain, the logistics resources, and the leverage we have within the industry to be able to access some of those resources. And then on the testing side, this is probably the thing that has been the biggest help from day one through now, is the expanded availability of COVID testing. Actually, early on, we were very appreciative of UTMC, who had the COVID PCR testing available and made some of those tests available to us. And then over time, we were able to take one of our analyzers and convert that to COVID PCR testing. So that could do over 80 tests a day. And then some of you have probably heard about the Abbott point of care tests. We have those as well. And we have about 12 of those units deployed in the process of being deployed in all of our emergency departments, as well as a few other places. So that allows us to make rapid decisions about where a person should go, what their COVID status is, and just remove at least that piece of mystery from the whole chain of outcomes and processes. And then the other thing is, we're very fortunate in that we have a robust research program here. We have treated with convalescent plasma, which you've probably heard about that before with the antibodies. And we have several additional patients who've consented for convalescent plasma. The challenge there is just the availability of the plasma, quite frankly. We also have several research studies that we've been approved for, which will make other options available for patients who come to us for care. I think, how does this all play out? What does it look like from the standpoint of really, I guess mortality is the ultimate measure of the services that we're providing and the care, compassionate care that we're providing to patients. You've heard about mortality rates in New York City associated with vent-related care at about 88%, which I would say is very high nationally. More likely, the national numbers look to be 50 to 60%. There's a number for acute respiratory disease or ARDS that's in that 20 to 30% range. And that's much more where our experience has been. So we feel like not only are we providing care that's safe for our staff members, but it's also care that's effective for patients that have come to see us. Just the other thing, kind of on a tangent related to this, but what we've seen is, as you've noticed in the community, a huge change in how we do office visits. And we've moved to red and green sites to preserve PPE, to keep our providers safe, and shifted a lot to virtual care. We've probably shifted 70% of our visits to virtual visits at this point in time. That we haven't shifted is just visits that are very difficult to switch to a virtual scenario. Think, for example, orthopedics or something along those lines. So I think that's going to be a sea change in how we think about how office visits are provided in the future. So I think that's something that we all have to plan for as we think about what's next. I'll just talk a little bit about what's next then as far as ramping up. We've seen within our emergency departments during, the start of this until now, about a 50, even over 50% reduction in emergency department visits. The ED is the front door for most any hospital. And when you see a reduction, certainly a lot of that has to do with people who maybe didn't need to come to the emergency department in the first case. So they decided to defer care. But there are also a lot of people who should be coming into the emergency department or to the hospital to get their care, and they're choosing not to. And that's obviously a concern. We're starting to see an increase in those numbers over the past week and a half to something starting to get back to where we used to be. But, I think the message here that I would want people to know is we do everything possible to make the hospital and the emergency department a safe place to come, from how we cohort patients with those with respiratory disease, without respiratory disease, the fact that we don't let people sit in the waiting room, we pull them right back to one of the private rooms, the exam rooms. We have appropriate masks, personal protective equipment, as well as rapid testing available in the emergency department. So we don't want people staying home, not getting the care that they need in those acute situations. The other thing that we plan for early on and that we have worked towards is to keep our Perrysburg Hospital COVID-free. So when we were doing our surge planning, we had developed different phases of facilities that we could pull into the mix if we needed, not knowing how many patients that we might ultimately have. And so Perrysburg Hospital was part of that, but it was actually towards the end, because what we wanted to be able to do is to keep Perrysburg Hospital COVID-free. And to our knowledge, we have done that. We've not admitted any patients who were COVID positive there. We've not had any staff who are COVID positive work there. We've not, anyone who comes through the emergency department there that tests positive for COVID gets transferred over to St. B's. So we think we've provided as safe as possible setting for people who are choosing to receive care that's maybe time-sensitive care or elective care in keeping with the governor's orders. So we think that's an important community asset to be able to offer that. The other thing that we're doing is that we're testing all our providers and all of our staff that work in procedural areas. So if we have a physician, if we have a surgeon who is going to start doing elective cases, and this has been a very hard time for everyone, including surgeons who haven't been able to work, we're testing all the OR staff, the pre-op staff, the PACU staff, to make sure that, going back to our core principles, that we're not putting anyone at risk for COVID unknowingly. So I think that's something patients should expect and ask for, and that's something that we're doing. So, you know, at the end of the day, we're part of this balance equation too, trying to make sure that we're doing work that's appropriate and safe, that doesn't exacerbate any of the issues that are out there. And hopefully this provides you a little bit of an overview as far as how we're addressing that. And I don't know how you want to do this from here, but if there are questions I can answer, I'd be happy to try and do that.
Excellent, Bob. Thank you very much. We will open it up for questions. So if you've got a question, go ahead and raise your hand. Or as I mentioned, I threw out in the chat that we appear to be having some chat issues today. So the group chat is not working, but you can send me a message privately and I'll put you on directly with Bob. We're going to go with Dr. Greg Guzman, who's got a question. Greg, you are unmuted. Go ahead.
Thanks, Bob. Quick question for you, a little bit of a selfish question, I suppose. I'm with Hondros College of Nursing, so we're the largest nursing college in the state. We've been receiving calls daily from hospitals, systems, including Mercy, looking for students. Do you guys have a plan yet on how we're going to reintegrate them to build up the nursing corps? For everyone else listening, we've seen a lot of nurses on the front lines retiring who have been near of age, or others who are using their sick time significantly and just calling off. So the need for student nurses has been incredible. I had the opportunity to work with Senator Gavrone early on in the process to bypass the NCLEX testing, the final nursing examination testing, because the testing centers had shut down. So that's in place for a little while longer. But really my question for you, Bob, is what do you see happening to help build up the student nursing corps within your facilities and healthcare facilities really throughout the state and across the country?
Well, thank you for that question, and thank you for what you're doing, because you're absolutely right. The continued education of healthcare professionals, particularly nurses, in this environment is what we rely on. Ultimately, we're a people business, and what we need is caring, compassionate, competent providers. And so thank you for what you're doing to help provide that. Probably the tip of the spear for the question you're asking has to do with, I'm thinking clinical rotations. And so I see your head nodding with that. So out of an abundance of caution and safety, as well as trying to preserve personal protective equipment, we ratcheted back those clinical rotations as we got into and really eliminated them as we got into the COVID situation. And we have since decided, and I'll have to go back and look at the date, you should have a communication on this, but we are opening up clinical rotations again. It'll be somewhat limited so that it won't be in a COVID area, so we can continue to preserve PPE. It'll be in those non-COVID areas, and so there'll be some restrictions on it. But Jody Paul, our Chief Nursing Officer, put out a communication maybe last week. And so I don't know if you got that, but I'll make sure after this call that your organization or that you receive that communication, because you're right. Those are experiences that are, if we're going to have that competent workforce that we need to have available.
All right, next question is from Dan Pienta. Dan, let me unmute you.
There you go.
You can go ahead.
All right. Hey, Bob, thanks so much for coming on the Zoom. It's been great to hear from you. My question comes around to, I know in my business, the heating and cooling, our business model is getting a little upended here. We're going to look different 12 months from now than we do today. I'm kind of questioning, what do you think your business model looks like? How do you guys, if you look back 12 months in the future to today, what would 12 months from now look like from your perspective? Where do you see you're going? And what are things that we could be learning from you?
I really appreciate that question, Dan, because that is one that we're probably up to our eyeballs in trying to figure out, what does the future look like? What's the old saying, the future isn't what it used to be? And it clearly isn't what it used to be. I'll tell you, in my office, I had a board that said, we're going to put a primary care location here, and we're going to put a primary care location over here, and we're going to make sure we've got good access points over here, and we're going to build a recruitment plan that meets that. And then COVID hits, and 70% of our visits are virtual. And so, do we really need to, lease or build all those buildings when people have kind of made, well, two things have happened. CMS and Medicaid created waivers that allows virtual visits to be much easier to do, and as well as to be paid for, which is a big component of that. And then people kind of got used to virtual visits, and rather than having to get up, shower, put make yourself look nice, drive into the office, wait however long to get in, and then sit in the exam room waiting for someone to show up. How much time does that waste? An hour. I can just do a virtual visit in my PJs, and 5 minutes before my appointment, sign in. So if we look at so there'll be big changes on the ambulatory side. I know I'm going to get it wrong, but it's probably going to be a combination of face-to-face visits, virtual visits, and maybe even some AI components in there. So we might have, Dr. Smith, who's embedded with Dr. Anderson. Dr. Anderson's at the clinic, does face-to-face visits, and Dr. Smith is their virtual partner. And when somebody needs to see someone face-to-face, you can go see my partner, Dr. Smith, at the clinic. So I think, we'll see less there. Another thing I'll say is, you start to get creative when you have to get, when you're facing scarcity. I don't think anyone here felt like we could ever turn, a 77 bed facility into over 150 critical care beds. We'd have been, if you'd have said we needed 150 critical care beds, we probably would have been talking about a master facility plan, where we're going to build the next tower and things like that. I think we're getting more creative about how we use our resources, how we can flex our capacity to different uses without having to invest a lot of dollars into it. So I think that's another element of it. And then I think probably just our intention, hopefully, our attention to infectious disease in general, strategic stockpiles, whether it's ours or at state level, the sort of space and resources and training and staffing models that you need to do that. We never would have gotten to a mass event protocol if it hadn't been for this. The amazing thing is our staff love it. They are incredibly engaged. They want to work there. They enjoy it. So how do we hang on to some of those staffing model changes without just automatically flipping back to what we used to do? And it's going to be a whole lot more that, a lot smarter people than me will predict on, but I think those are the things that come immediately to mind.
All right. Next question comes from Phil Mercy. Phil, I'm trying to unmute you. And you can go ahead.
Can you hear me?
Yes.
Okay. Hey, Bob. I can only assume you're probably up to speed on what's happening with the University of Toledo and ProMedica and the displacement of the College of Medicine and Life Sciences and the potential sale of the hospital. Do you feel Mercy Bon Secours would be a good fit for their proposal for the UT Board of Trustees, that is? I certainly think you would be.
Well, I don't know for sure if I should answer that question, though.
Yeah, and if you want to, if you need, I understand that's a sensitive topic. If you need to punt, it will not be held against you.
I mean, what I would say is, they are great organizations and incredibly important to the community. We are certainly aware of the process that the university is going through and assessing whether or not we want to be part of that process and if it would make sense for us or not.
Excellent. All right. Thank you very much. Next, we're going to go to Kevin Dalton. Kevin, you can go ahead.
Hey, good morning, Bob, and thanks, Kevin. Thanks, everyone, for being on the call. Bob, I appreciate everything you've said today, and I just want to also recognize the fact that Mercy, at your leadership and direction, was one of the first groups to participate in supporting students at Toledo Public Schools with reaching out with over 100,000 meals. And again, just your foundation at your direction a week ago has now stepped up again, committing a couple 100,000 or committing the drive to help generate another couple 100,000 for the students and meals for kids. So on behalf of the Toledo Federation of Teachers, I want to say thank you and all the students we've served. It's been tremendous. And I know that we've been working pretty close with some of your team as far as regarding creating some safety precautions for students and opening up these schools. So I appreciate your leadership in the region. Thank you.
Well, thank you for that, Kevin. And let me just say thank you for your leadership in organizing this and getting it pulled together. And we're very proud to participate with other organizations in something that is obviously an underrepresented yet incredibly acute need for our kids. So I think this is where community leadership like yours and others has really been important.
All right, Brent Kuzno is up next. Brent, we're gonna go to you.
Can't hear you, Brent.
Okay,
Gotcha.
right there. Now?
Yes.
Okay. Bob, thanks for being here. I just was pleased and pleasantly surprised that you joined us. I happen to have the good fortune of sitting on the regional board and get to see Bob on a regular basis. Bob left a couple things out, and I do want to say that it was mentioned, but important, that he ran Lima Division very, very successfully for about 7 years. And we were just very fortunate that Brian Smith, his predecessor in Lima, who came to Toledo and turned the Toledo region around, was wise enough when Brian got tapped to go to Cincinnati. And now Brian is the #2 in the entire Bon Secours health system. So Brian's down there, but he smartly brought Bob up to run both Lima and Toledo region. And he's done just an awesome job. And not only do we have Brian as #2 in the entire health system, having run Toledo, but John Starch, who is the CEO of the whole system, he started his career in Toledo. He worked at UTMC. His very first experience with healthcare was at St. V's when he was a student at Bowling Green State University and got his law degree at the University of Toledo. So Toledo is a very big part of the entire Bon Secours Mercy Health system, which is well over an $8 billion enterprise. So that's a paid commercial from Brent Kuzno. But I do want to ask you, Bob, if you would share, because I think a lot of people don't know this, and I appreciate what it brings to Toledo, which is sort of the financial strength of the system and how that's evidenced itself in what we're doing in the Toledo region, as well as sort of our market position, which I think a lot of people are very unaware of, if you don't mind.
No, I'd be happy to. And your check is in the mail. So thank you for those kind comments. And for those who hadn't heard, I just a quick shout out to Brent. So I mentioned the challenge of personal protective equipment. While we're doing well, it's certainly not without a lot of hard work by a lot of people to make it happen, including the community. And Brent was able to partner with Dave Corwin. Masks were a critical issue for us, and he was able to help arrange for a couple of flights actually, out of Mexico into the Toledo airport. I'm going to say probably over, I forget, so Brent, please correct me, over 200,000 masks at the end of the day that were able to be brought in and supported us as well as other organizations in the community. So it's just the sort of community engagement that we're so appreciative and beneficial to have. Back to some of the questions that Brent was asking. From a market share standpoint, I know early on when I got here, I had certain assumptions about Toledo just based in being in Lima and kind of what the market position was. As we look at market share, we're actually the market share leader in the Toledo area. And we're the only system to have growth in all the major service lines over the last couple of years. So, we feel very good about what we're doing and how we're doing it and the sort of clinical services that we're providing. Ultimately, if that's what's happening, that means that we're providing services that people need and value. From a financial strength standpoint, actually just last week, there was a story out in Becker's, which is a national kind of healthcare publication. So you wouldn't see it unless you were in healthcare probably. But they listed 9 health systems with strong finances and a strong balance sheet. We were one of the 9 that they talked about. Bon Secours Mercy Health is rated by Fitch's as AA- with a stable outlook based on broad geographic footprint, diversified service lines, good strategic planning. So I think, we're going to face the same headwinds as everybody else in the market, but we think we come at it with a strong balance sheet, which is going to be critically important. In fact, the ministry just committed recently $60 million to our staff through the foundation to make sure that people who are being low censused can still have full paychecks. So it's we haven't had to furlough any of our physicians. So I think it's some of those things that, you know, that gives us the ability to do.
All right, excellent. Thank you very much. All right, so that's going to be all the time we have for questions. We got a few more questions that came in through chat, a few more people that had some questions, but out of respect for time for Bob and to keep our meeting on schedule as well, I'm going to pass it back to President Tim. Bob, thank you very much.
Thank you.
Thank you very much, Bob. I appreciate the presentation today. And because I'm the president, I get to ask one more question that's burning with me. And that is, I don't know if you're the right person to talk to, but you may be observing things in terms of suicide and mental health and domestic violence appearing at your door. Could you take a few minutes and respond to that if you wish?
Yeah, I would be happy to. As you look at the future, Dana asked the question, you know, what's the future hold? I think one of the things that we all have to be prepared for is the impact of a mental health crisis across the country. You know, people, you know, are very social, and then you have isolation combined with loss of income, combined with just the stress of concerns about health and loved ones. And there's every reason to believe that, you know, we're going to have a secondary sort of shadow pandemic, or, you know, crisis. Pandemic's probably too strong a term, related to mental health. In the Toledo area at St. Charles, we have the Behavioral Health Institute, you know, which probably takes care of about 80 patients on a typical day. But candidly, that's not where the most important care takes place in the behavioral health world. It's an entire continuum, and really, you know, it's the acute place where, you know, when other things just haven't been what was needed, is when a person ends up there. So it really is an investment in those outpatient resources. And I do think if there's, you know, some good things about what we're going through, we have found that behavioral health is one of the places that virtual visits and telehealth visits can be very effective. We have a number of behavioralists, not only at Behavioral Health Institute, but embedded in our primary care practices, who do teleconsults for behavioral health purposes. So we think that's part of the solution, or at least part of addressing the need, if not the solution. So, but I think you're very perceptive to call that out. And it's not something that, you know, we tend to like to talk about as much as some of the, you know, some of the more interventional and sexy procedures, if you will. So it's something we need to address.
Thank you very much. That was a great presentation, and I think we needed to hear that it was well presented, and we're grateful and honored that you would be here today. And in recompense for your visit, we sooner or later, when we get into our play or back to our space, we will provide you with a book, The History of Toledo, and we will also make a contribution in your name to our Polio Plus Fund, which is a major issue for Rotary worldwide. So thank you for being with us.
Thank you. I hope that day comes soon where we can all get back together.
So do I, my friend. Just going to make a little transition. Is Dean Neese out there in the audience? Dean, are you on?
I am on.
I understand that you lost your old job.
Well, I lost the old one, but got a new one. Yes, thank you.
Okay, so my understanding is you are the president. Make sure I get this corrected. Mackey and Smith.
President, CEO of Manick & Smith as of last Friday.
Okay, so how long have you been there?
36 years. So.
Well, so you finally made it to the top.
Yeah, you got it. Nowhere else to go, so I guess I have to. Yes.
Congratulations. You're a great Rotary. Glad to have you. So
thank you.
All the best to you in your new job. We have a book club that is being formed right now. And you can get the information on that in the Spoke this week and connect to that. Kurt Church, are you out there somewhere? What's going on in your world with the four-way speech contest?
Well, next week we will be showcasing the winner. She's now become a two-time winner as she won last year. Olivia Wetzel her video will be shown at next week's meeting. In addition, we are reaching out to the mock interview, otherwise known as Interact interview participants, to see if we can schedule some sort of similar Zoom type presentation with volunteers in chosen careers forward. Also, a new development in the Habitat for Humanity Maumee Valley chapter. A restoration project will begin in June that an internal grant was given from the Toledo Rotary to Habitat for Humanity for this. So we'll be looking for volunteers on several dates to participate in the renovations of Toledo City Home for a working mother and her two children. Her name is Kelly Davis. So look out for those days to sign up for demolition and reparations to this home in Toledo.
Excellent. So you got, we're going to hear from four-way speech contest next week, correct?
Correct. Yep.
You're going to be looking for volunteers, business leaders, which is what Rotarians are, to do mock interviews with high school, I presume mostly graduating students.
Yes, that's correct.
We'll be looking for volunteers for that.
We'll be looking for volunteers based on students' potential career choices, correct.
And we're going to move forward with the Habitat for Humanity House.
That's correct.
Okay, Sharon Trebek will be very pleased to know that, I'm sure.
She probably already knows.
She probably already knows. We're going to ask our executive director to give us a report.
Thank you, President Tim. Yeah, I'm on now. Thank you. Just a couple of announcements regarding Zoom. There will be some changes coming forward, and just look for that information in the Spoke. Eventually, you're going to need to have the password, so that'll be new information, new insight, but it will be coming. The main reason I wanted to speak was just to remind everyone that on Friday, we sent out a survey to ask your opinions about moving forward with the club. Everyone loves Zoom. We're doing a great job, I think. But please complete that survey. It was also included a link in this morning's email. And I've heard from about 25% of the club members. If I could get your responses by end of day tomorrow, then we can share that information with the members of the board and continue to move the club in a positive direction. So thank you very much.
Oh, there you are.
Hi, President Tim, how are you? I just wanted to make a quick announcement about our second Zoom Happy Social Hour that's going to happen this Thursday at 5:30. Our theme will be the movies. We'll have everyone start out by telling us what their favorite movie is and why, and then we're going to do movie trivia. So you can bring your favorite beverage and hang out with your favorite Rotarians at 5:30 on Thursday evening.
That's this Thursday?
It is.
Do we have to register for that, or how does it work?
No, you don't have to register. Just show up. Just dial into Zoom. There will be an invitation. You will see it in your Spoke, and just come on and join us and have a good time.
I have to tell you, I attended the social meeting, I guess it was about 2 weeks ago, 10 days ago. So it was a lot of fun. I had a great time. And all of the people at that meeting, I liked most of them.
I hope you like me.
I do, very much. As I begin the process of shutting down the meeting, I just, again, because I'm the president, I get to say a few things, and it's my honor to do that. But as we as we go through this virus, this disease, and all of our lives are being interrupted, and it's tough sometimes. You know, you find yourself feeling alone, and you find yourself being in very close quarters that you're not normally used to. So just a few things I picked up from Cindy along the way. And for those that you don't know, she's my partner. And she had a comment today as in her relationships over the phone, mostly, and Zoom, and with me, I guess. She told me today that it's better to mend fences than to gather up the herd. And I thought that was something I'd share with you. It's probably true. Again, back with the relationship, you know, it changes. Things are moving around, and we're spending lots of time together. And I noticed that she began this game. It's kind of like 20 questions with me, and you know, very personal questions I thought she knew the answers to. And I finally said, what's the point of all these questions? And she said, I'm just filling out a form for you. And I said, what form? And she says, it's one that I found on Match.com. And the other thing, we were talking about how are things going. And she says, you know what goes really well? You know, for a couple, if one of them are deaf and the other one doesn't pay attention. That's my thoughts on the virus right now. I'll be glad when this whole thing is over. Rita, thank you for arranging this social meeting. I encourage everybody to go. I can assure you that it will be a good time. I'm hoping that Chuck is out there for a little chuckle.
Here are a few definitions. Calories. Calories are tiny creatures that hide in your closet and sew your clothes a little bit tighter every night. Vegetarian. Vegetarian is a Latin word that originally meant really bad hunter. Feet. Feet are devices used for finding Legos in the dark. A cashew. Cashew is the sound of a nut sneezing. Waiting for laughter to die down before I go to the next one. Spider web, the thing that you walk into that instantly turns you into a karate master. And this one would be a good one for Mr. Baxter if he's still listening. The definition of a nurse is the first person you see after saying, hold my beer and watch this. Relief is what trees do every spring. And finally, latte. Latte is from the Italian, meaning you really paid way too much for this coffee. And that's that.
Thank you, Chuck. As always, I appreciate it. I'll have to think about all of them. So thank you for that. Our next meeting is Monday, May 18th. We'll be joined by Steve Robinson from Owens Community College. And with that, we are adjourned.